So let's talk a little bit more about what it looks like on the ground. So some of the impacts that we're seeing on students and schools and our entire community, basically. So what are some of the things that you've observed in terms of impact of this program over the last year as we've gotten it off the ground?
Yeah, I think what we really found was that it created, and I think you mentioned this earlier, a pathway, just this pathway to discuss mental health, remove that stigma of these discussions, equip adults with the skills needed to have these discussions, really provide an inroad for schools to engage parents to support youth mental health as well. Parents were grateful that it opened up conversations with their kids, especially those who reported that they had suspected a mental health issue, but they just weren't sure how to address it. So again, giving them that language, empowering them to discuss really tough topics with their kids, but very important topics. The staff were surprised at the schools that we conducted the screener in. They were very surprised at the number of students identified as having mental health needs that were not already identified as being at risk. They weren't already connected with a counselor. Oftentimes, the counseling staff and the admin will say, hey, we know who our kids are that we need to worry about. And this really showed that they didn't know all of the kids, and there were some that were just not on the radar. The screening really allowed staff to develop supportive relationships with youth and their families. Again, that connection and support, and to have a list of resources at the ready was also very important to staff. It was really a catalyst to connection, support, and increased student engagement and success across the board in the schools that implemented this program. And I think, what you said earlier, Dr. Salerno, about hope, connection, and care, that really summed it up.
Mhm. Yeah, same. I think what stood out to me is all the things that you shared, like not only the difference the screening made for individual students, but how it really reshaped how those schools were thinking about who was at risk and just mental health as part of their culture.